can officially start. Hello and good afternoon, everyone. Thank you for joining us this evening. On behalf of PAN Settlement Services, I'm very pleased to have four speakers with us tonight to talk about affordable dental care in Ontario. They will introduce themselves shortly and then walk you through a few aspects of dental care, including foundation of oral health, the government programs, and what to expect during the dental or hygiene appointment. And they might also cover additional topics that will help you further. And then we can conclude the seminar with Q&A. If you have any questions, you can write it in chat section or raise your hand after the presentation. And if you're more comfortable with Farsi, you can write it in Farsi. We can translate that into English and answer your question. And without further ado, thank you again for this opportunity, and I'll pass it over to you to introduce yourself, your team, and then start the presentation.
Thank you very much. Okay, so I'm just going to get it ready here. Okay, good evening, everyone, and thank you so much for being here today. Before we begin, I want to sincerely thank PAN Settlement Services and Kaveh Aziz for arranging this meeting and for giving us this opportunity to speak with you. We truly appreciate everything they do to support newcomers, families, and our community. Their work makes a real difference, and we are grateful to be part of that this evening. So my name is Nilufar, and I'm here with my colleagues Anusha, Jan, and Danica. We are all dental hygiene students at the Canadian National Institute of Health, or CNIH. Together, we have prepared today's presentation to help you better understand oral health and the affordable dental care options available in Ontario. We work with clients every day during our clinical training, and one of the most common things we see is that many people don't realize how closely oral health is tied to overall health, or that there are programs that can help when dental care becomes too expensive. So today is really about awareness, prevention, and empowerment. We welcome any questions you may have, and we are here to support you. If English is difficult, I am more than happy to explain any topic in Farsi as well. So before we jump into the main slides, I'd like to give you a quick overview of today's session, and so you know exactly what to expect. I'll start with why oral health matters. And then I'm going to give you some definitions from like the World Health Organization defining health and oral health. And then I'll talk to you about the strong connection between oral health and overall health. After that, Anusha will introduce a dental hygiene framework that we as dental hygiene students use to assess our clients' needs. And then she's going to talk about why certain needs go unmet and how this impacts individuals and families. And finally, Jan and Danica will walk you through the main programs available in Ontario that help make dental care more accessible. So with that overview in mind, let's get started with the foundation of everything, the importance of oral health. So maintaining oral health is essential for daily living. It affects how we eat, speak, smile, and interact with others. But more importantly, it affects how we feel about ourselves. When your mouth is comfortable, clean, and healthy, you naturally feel more confident and more willing to smile, laugh, and communicate with others. But when oral health is neglected, whether due to cost, fear, or lack of access to care, or not knowing the signs, it affects nutrition, comfort, communication, or even our emotional well-being. A lot of people think that oral health is only about brushing and flossing their teeth, but it's really about your overall quality of life. For example, if someone has constant tooth pain, they might avoid talking or avoid certain foods or avoid smiling in photos. They, like this whole thing can affect social interaction and confidence. And that's why oral health matters for everyone at every age. So let's look at some definitions here. The World Health Organization describes health as a state of complete physical, social, and mental well-being, not just the absence of disease. This means health isn't just whether something hurts. It's actually about whether you are able to live comfortably, participate socially, feel confidence, and actually enjoy your day-to-day life. When we think of health this way, it becomes very clear that our oral health is not separate from overall health. It's actually a major part of our whole body health. So oral health is much more than teeth. It includes the ability to chew, speak, breathe, and smile comfortably. It also includes self-confidence, emotional comfort, social well-being. But when oral health declines, people may feel embarrassed, isolated, or anxious. They may avoid social situations, stop smiling, or have difficulty communicating with others. So oral health affects our physical comfort, emotional well-being, and social quality of life all at the same time. Now that we understand what oral health is, let's take a look at how it connects to the rest of our body. So the Canadian Dental Association emphasizes that oral health is directly connected to overall health. A healthy mouth allows us to eat nutritious foods, communicate easily, and enjoy life without discomfort. But when oral health declines, the body is affected in many ways. Let's talk about some of these effects. Let's think of our mouth as a doorway to the rest of our body. When gums are swollen or bleeding, the bacteria can travel from our mouth into our bloodstream, and this causes inflammation in other parts of our body. One of the most important ones here is our heart health. So gum disease is linked to heart disease and stroke. Why? Because the inflammation in gums can also contribute to inflammation in blood vessels. Another important link here is diabetes. So with diabetes, it's like a two-way relationship. People with uncontrolled diabetes are more likely to have gum disease. On the other hand, people with gum disease and diabetes, it's kind of makes it like harder for them to control their blood sugar level. The next one I want to talk about is serious infections. Tooth infection can actually spread into the jaw, face, and in severe cases, it can actually spread into bloodstream. So this infection can travel through our body and causes some medical emergencies. The next one that we already talked about is nutrition, and it is an important point here. Because if chewing is painful, obviously people avoid certain foods. Children may become picky eaters, or older adults may struggle with healthy meals. As a result, poor oral health is poor nutrition. And then the last but not least is pregnancy. Poor oral health during pregnancy is linked to premature birth or a low birth weight. So, all these being said, if your gums bleed when you brush or floss, if you have persistent bad breath or bad taste in your mouth, if your jaw hurts, and if you have trouble chewing, these are not normal. These are signs that you should see a dental professional. Now, we understand that dental care can be expensive here in Canada, and this creates barriers for many people. But taking care of your mouth is essential because of all the effects that we talked about. It affects how we eat, how we smile, how we speak, how we socialize, and how confident we feel about ourselves. The good news is there are programs available. Sorry. There are programs available in Ontario that actually help make dental care more affordable. And later in our presentation, my colleagues will walk you through exactly what those programs are and who qualifies for them. And now I will pass it on to Anusha, who will talk to you about unmet human needs in dental care.
Perfect. Thank you, Nilo. My name is Anusha, and I will be discussing, like Nilo said, I'll be talking about some unmet human needs when it comes to oral health. So as the name implies, these are some of the needs that in general we don't think is important, and then it's been overlooked, and then it leads to some serious cause. So before I dive into it, I just want to know with the people present here, if you'll have any unmet human needs. It can be bleeding on brushing, it can be bad breath, it can be a broken tooth, it can be anything. But I just want to know if there is anyone here, feel free to unmute or put it in the chat. Alrighty, I'm going to start off by myself. I feel a little bit conscious when I smile because I feel like I have a little bit of proclined teeth, and that gives me that feeling of unmet human need. So as dental hygienists, when you visit someone, we look at all this, like we look at everything, and we analyze and assess everything, and we come to a conclusion. And then we give you certain goals on how to meet these needs, and we help you with it. It is more of hand-in-hand process. So this unmet human needs, it is a method where every dental professional will use to assess all the oral health needs of a patient. It helps to analyze a person's unmet need and the underlying cause. So if let's say you'll have bleeding on brushing, it's usually not normal to have bleeding on brushing. But because there's no pain associated with it, most of us, we tend to overlook it and we just carry on our lives. So this is something where that comes as a part of not understanding the concept, and that's an unmet human need. So as a dental hygienist, I come in and I explain you that it's not okay to have bleeding gums. So if you follow certain steps and if you do proper oral hygiene routine, this can be avoided. Because healthy gums is the key to having a good oral health. And then there are a total of 8 unmet human needs that are often overlooked by patients until it's brought to their attention. Now, as a future dental hygienist, we come into action, we set client-centered goals, and we do our bit. We use our tools and we go in and we clean deeper. And then we teach you the proper brushing methods, the proper flossing methods, and if there is anything more that you'll need to do, everything will be taught. And then we keep evaluating on how much progress we can see to help you all achieve that perfect oral health. Next slide, please. So here are the 8 unmet human needs. So I'm just going to give you all a little bit of explanation on each of them. So starting with wholesome facial image, this is for those people who are a little bit conscious to smile or to even just present themselves in front of like in general public or pertain to a dental clinic or dental professionals. It can be due to staining, it can be due to uneven teeth, it can be due to anything. And this is where we come into action and we give you all the outcomes that can be done, and we'll give you the best treatment plan possible in order to achieve that wholesome facial image. Diabetes and hypertension, pregnancy, and all of these, there are certain health risks that are associated when it comes to oral hygiene. So when, like for diabetes, we see a lot of dry what are the consequences? What are the consequences that you all can see? And we give you like a detailed outline to help you all overcome this unmet human need. Next, skin and mucous membrane integrity of head and neck. So dental professionals, we are basically pertained to head and neck regions. We make sure when you all walk into a dental setting, the first thing a dentist or a dental hygienist would notice is your posture and your gait and your overall physicality. And then we also look at the tissues inside your mouth just to see if there is anything going on. It can be as simple as inflammation. Inflammation is nothing but swelling of your tissues. There's redness and there is, your tissues look redder than normal, like it's pinkish red to red. So when we see all these signs, we know that there's definitely something going on and we'll educate you on that. And then if you all can have enlarged tonsils, you all can have, and all this has an indirect impact on your oral health and we can figure it out right away. So we take care of skin and mucous membrane and we'll help you all achieve that unmet human need. Freedom from head and neck pain. Like I was saying earlier, we look at extraoral tissues as well. We see if there is any swelling or if there's any infection that's hiding. We do like a complete extraoral examination to free you from that head and neck pain. I don't know if a lot of people know, but a lot of us have this habit of clenching and grinding when we are stressed. And that indirectly, it has a connection to cause neck pain and headaches. And especially when you all get up early in the morning, if you all are having headaches, then I would definitely insist that you can mention that to your dentist or a dental hygienist if you'll have one, and they'll definitely help you overcome that. Freedom from anxiety and stress. This is one of the major things that we see in our practice. A lot of people, it can be due to bad experience in their childhood or recently, there is this anxiousness that's formed when they see some people are just anxious looking at the needles. Some people are just looking at the chairs, they get anxious. So it can be anything, and there is a strong underlying cause to it. So when we notice all this, we take everything into consideration, and step by step, we help you how to overcome that anxiety. And stress can be in many forms. Like everything in dentistry is so expensive that it's hard to afford certain treatments. So financial stress is one big cause that most of the people, they don't take that first step that's required in meeting this unmet human need. Responsibility for oral health. So this is just taking that responsibility that you all need to get that perfect oral health. A lot of people in my practice, I see that they're brushing twice a day, but they don't floss. It's just because, not that they don't want to, but it's just that they don't know that it's required. So that's where we come in, and we'll be like, oh, like it makes $1 million difference. Like you can see it once you floss, you immediately notice in 2 weeks that all your gums and your teeth, they start becoming healthier. Your gums shrink back to normal and it gets tighter. And most of the bacteria resides in between 2 teeth. Like if this is your teeth, like it's in between the 2 teeth. So flossing in between the 2 teeth definitely avoids cavities. And then the last one is conceptualization and problem solving. Like I said, a lot of people, while brushing, they see blood, but then just because there's no pain associated to it, they'll feel like it's going to stop. Of course, it will stop, but it's just not normal. And a lot of people don't know that. So it's just a concept that's not been understood properly. So education is one of the key component that we work on, and every client that we see is definitely educated to raise this awareness. Next slide, please. So now I'm going to discuss about unmet human needs and how does it impact us. So every unmet need has an impact on our oral hygiene, like I just said. All these unaddressed human needs concerning dental care have a considerable and an extensive adverse effects on a person's total physical health, mental and emotional wellness, social interactions, and economic security. These problems frequently lead to a cycle of declining health and heightened obstacles to receiving dental care. A dental hygienist plays a crucial role, and we help you all set client-centered goals. Like, let's say if a person's brushing once a day, we encourage you all to brush twice a day. We encourage you all to use a fluoride toothpaste. We encourage you all to start flossing. So all these goals are set, and then as you all progress towards it, we walk with you, and then I do my bed, you all do your bed, and that's it. That's all that's required. Next slide, please. So how to meet these unmet human needs? So once these goals are done and once I do my jobs, there is still a certain criteria that is not met as to how to take that first step. So we are just going to dive deeper into that. And this is to support a better health and address these human needs. The government of Canada is offering some dental plans. Depending on certain criteria, you can be eligible for these plans, and you get to take that first step towards your oral health. Next slide, please. Now I invite Jan to walk you through this process, and if you'll have any questions, you all can just chip in.
Hi, I'm Jan. Thank you for having me here today. I'll be talking to you about Healthy Smile and CDCP. Let's explore and find the right dental care program for you. Children 17 and under, you may be qualified for Healthy Smile Ontario. Seniors 65 and older, you may be eligible for the Ontario Senior Dental Care Plan. Newcomers with refugee status, you may be qualified for the interim federal health program. Canadian resident without dental insurance and with a family net income under 90,000, you may be eligible for the Canadian Dental Care Plan. Let's begin with Healthy Smile Ontario. This program offers free dental care coverage for children from families with low income. The goal here is to remove barriers to dental care and prevent dental disease before they start. Who can benefit from this plan? Ontario residents, children aged 17 and under. You must meet the household income requirement, then you'll be qualified for this plan. What is the household income requirement? The family net income must equal to $28,523 or less for one child. What happens if you have two children instead? Then your family net income will be $30,682 or less. Basically, for each additional independent child you have, you will add $2,159 to the family net income amount. Let's go over how to apply for the service. We will start by visiting the online portal through Service Ontario. To apply, you'll need to provide proof of your child's date of birth, valid Ontario address, social insurance number, or temporary taxation number. If you don't have any of these documents, then you will need to get a guarantor to sign for you. A guarantor must be a Canadian citizen, age 18 or older, a member of a regulated profession, who can confirm your identity, your age, your Ontario residency. Example of a regulated profession that includes a judge, a lawyer, doctors, nurses, midwives, dentists, hygienists, pharmacists, and other regulated professions. Now let's look at what this program covers. It covers typically exams and checkups, x-rays, cleaning, fillings, tooth removal, or urgent dental care. However, it does not cover cosmetic service, such as whitening and implant. Now, you could take out your phone and then scan this QR code and follow along with me. Okay. Here, you'll find more details about the service and the cover and the frequency of the coverage. So right here, they tell you all the services they cover. And then for the exams, they tell you how often they cover, what kind of exams and how often they covered here. And then the type of x-rays. And then the preventive service, what are they? And then restorative, and then root canals. And so this is what, okay. And then I'll guide you how to apply for Healthy Smile and then get the guarantee forms. Here you can scan the QR code and follow along with the online application. And then here you could click the start of this one. It will get you directly to the application and you can fill it out online and submit it online. Or this from here, this is the form that you have to download to get the guarantor application. So you will download, like it only offers in English and French here to download that. And then you go back here. And this one is for the public health locator. This is to help you to locate your nearest public health service. Okay. Now let's take a look at the Canadian Dental Care Plan. It's a federal program that helps Canadians residents who don't have a private dental insurance to get what they need. Who qualifies for this dental care program? Any Canadian residents, adults, seniors, kids, and people with disability with no dental insurance at all. That means no dental insurance through your spouse, work, school, or pension plan, except if you're a retiree and who have opted out on December 11, 2023 and cannot opt back in. This also means that you cannot purchase any private dental insurance as well. And your family net income must be under $90,000. If you meet all these requirements, then you can apply through the online government website or by calling their support line. They could help you. For the TTY, that is the line for those who have a hearing impairment or speech impairment. Okay, I will show you. So this is where you will apply online right here, and then you just click on this. And if you need to know how you qualify, you could click on this button here, and then they give you all the information, how you will be qualified. And then right here, you click here to apply, and then it will go through online. If you have an online account with the CRA, then you could apply directly like that way. Otherwise, you have to visit the government office to apply. Okay. Now let's look at what are covered under the CDCP and what you have to pay out of pocket. Under the diagnostic, under the diagnostic and preventive service category, there's the dental exam, X-ray, cleaning, fluoride treatments, and sealants for certain teeth for young kids. These services are to help maintain oral health and catch problems early. Next, the basic plan. These covers your fillings, pain control due to infection from cavity, or a root canal that you need to remove the infection and clean inside the tooth and then the space, and then they seal it with some material to stop the pain. And this kind of treatment, you may require pre-authorization. But under these basic category, it focuses on saving the natural teeth and stop the dental disease from progressing. For major restoration works, require pre-authorizations. This is like something like your crown that's related work that's you need a post or post removal or crown repair or cord buildup. These services are meant for teeth require more advanced restoration. Even with full CDCP coverage, you may have to still pay out of your pocket costs. This happens when there's a difference between the Canadian CDCP plan and the established fee and your dental professional provider fee. For example, today, if you went to get a cleaning and your cleaning cost is $180, and the Canadian Dental Care Plan established fees for the same service, it will be only $150. That means your government is only covering $150 for that fee that you're supposed to pay. So out of your pocket, you're going to still have to pay a $30 difference. So for tier 1, you will be 100% covered. You still have to end up paying $30. For tier 2, the government covers 60% of the $180. That means there's $90 that you'll still have to pay out of your pocket. And for tier 3, your government covers 40% of that fee. And in the end, you still have to pay $120 out of your pocket. Now I'll show you how the services are. Sorry, this one. So you can find all the details of the list of service here that they cover, and then they have it on the top here. It's like tell you all the lists and then the information, the pre-authorization, if you want to know more about the details of it. Okay. And then this right here, it shows you how the co-payment plan works. So basically, if you make under $70,000, you are 100% covered. And if you are between $70,000 to under $80,000, you're only covered by 40%. And then if you are 80,000 to 90,000, you're only covered by 60%. Okay, and now I'll pass over to Danica.
So thank you, Jen, and hello, everyone. My name is Danica, and the topic I'm presenting is one that affects thousands of individuals across Ontario, but often doesn't receive the attention it deserves. I will be discussing two major public dental programs, the Ontario Seniors Dental Care Program, commonly known as OSDCP, and later the dental benefits available to refugees through the Interim Federal Health Program, or IFHP. And my goal is to explain what these programs offer and who is eligible. And I will start first with the Ontario Seniors Dental Care Program. And this program was created in response to a growing public health concern. Many seniors living on fixed or low incomes were delaying treatment or avoiding the dentist entirely because they could not afford the cost, right? So dental care is not included in OHIP or the Ontario Health Insurance Plan. That is the government health insurance plan for the province of Ontario. So for someone living on limited income, even a simple filling or denture repair can be out of reach. Also, older adults are at high risk for several oral health problems, including gum diseases, dry mouth related to the medication they are taking, root caries, difficulty chewing, and oral infections. Poor oral health can also worsen medical conditions such as diabetes, heart disease, or respiratory illnesses. By offering accessible care, the OSDCP helps seniors maintain independence, proper nutrition, and quality of life. And this program provides free routine dental services to eligible seniors. And eligibility for the program is determined by four main requirements. So first, age. The applicant must be 65 years or older, so they can apply. Second, the applicant residency. The applicant must be an Ontario resident. Third, dental insurance status. So the senior cannot have any other form of dental coverage, whatever public or private. And fourth, income. So a single senior must have a net income of $25,000 or less. And for a couple, the combined income must be $41,500 or less. The application process is relatively simple. Seniors can apply online using their social insurance number or SIN number and their income information from the previous year's tax return. They can also apply by mail or receive assistance through their local public health units. Once approved, they receive an eligibility card and must renew annually to confirm their income status. So if the applicant, in case the applicant doesn't have a SIN number or did not file taxes last year, they must have a guarantor to verify their identity, age, and residence status. So on the slide, you can see there is a QR code as well in the bottom right corner. So you can access the official website for Dental Senior Program, which I will show you soon. And the services offered in this program include examinations, preventative cleanings, x-rays, extractions, and in many cases, removable dentures. These services are offered through public health units, community health centers, and a number of partner dental clinics across the province, but they need to be registered with this program. And one important note is that the dentures and other dental prosthetics mostly will be partially covered. So I will now share the official website. Just bear with me for a sec. So, okay, I hope you can see my screen now. The dental care website for seniors. So on this page, you can find about the program itself, who is eligible, how to apply, and what you need to do if you don't have a SIN or a SIN number or did not file a tax return. What should you do after you apply? You can find a participating dentist, renew your yearly coverage, change your account information. So some questions and resources. And with number 10, I will go there. This will be beneficial for someone who has a language barrier. I believe under the English section, there is a Farsi option, so you can access this page on Farsi. So about the program, so once again, the applicator must be 65 years of age or older. What is covered? So checkups, including scaling, fluoride, and polishing as well. Repairing broken teeth at cavities or caries, also known. X-rays, so removing teeth or abnormal tissue, anesthesia, treating infection and pain, so endodontic services, root canals, treating the conditions and diseases. And for the dentures, So you can also see there they will be partially covered. So you can access here to find the local public health units. So when you click on that, it will open the link. So you can write down your postal code or the municipality, like you can type Ottawa, and you can search for that area specific, the dentists who are registered with this program. And also important thing is that the coverage will end on July 31st, so every year, no matter when you are enrolled. And they are talking here about the eligibility, so about the annual net income for the single or for the couple, and have no other form of dental benefits. And here you can find how to apply online or by mail also. And in this section, if you don't have a SIN or did not file a tax return, a guarantor must help you apply by mail. So, and as Jen also talked, a guarantor is someone who can confirm the identity, age, and residency of the individual or couple applying to the program. And the guarantor must be a Canadian citizen and at least 18 years of age. If more than one person in your household is applying, you need one guarantor per household. And the list who is eligible for the guarantors, so nurse, pharmacist, for example, lawyer, so dentist, dental hygienist as well, judge, notary public, etc. And here you can find the information after you apply. And also important thing that you must present your card to a dental provider at each visit to receive services under this program. You can also find a participating dentist here. Again, the public health unit you can access from here. And you need to renew yearly coverage. How to change account information. And if you have any questions, concerns, you can always access and call these numbers. So I will continue with the presentation. Okay, now I will talk about the dental coverage for refugees, the Interim Federal Health Program, or IFHP. This program is a federal initiative that provides only temporarily health coverage to eligible refugees, refugee claimants, and certain protected persons who are not yet covered under provincial health plan. Canada recognizes that newcomers often arrive with immediate health needs, and dental conditions are frequently among these. So many refugees have gone months or even years without access to dental care due to conflict, displacement, or economic hardship in their countries of origin. So eligibility for this program includes, so to receive services, refugees must attend a dental clinic registered with Medavie Blue Cross, who is the administrator for this program, and not all dental offices accept this coverage, unfortunately. So many newcomers are referred to community health centers public health dental clinics or settlement agencies that maintain updated list of participating providers. And how it works. So coverage will be issued automatically by Immigration, Refugees, and Citizenship Canada. And you need to show your IFHP certificate or claimant document to a dental provider registered with the program. And the clinic will bill Medaville Blue Cross directly. So you have QR code as well on this slide. So to better understand this program's dental coverage, it focuses only on urgent or essential dental care. So services that address pain, infection, trauma, and serious oral conditions. These include emergency exams, diagnostic X-rays, simple and surgical extractions, urgent restoration, and treatment for oral infections. So preventative care like cleanings or cosmetics procedure is usually not covered. And the program stabilizes urgent oral health issues and provides relief until refugees can access longer-term options. There are some important limitations, such as for X-ray, which is covered only once per lifetime under the program. And as I already said, the routine checkups and cleanings are not covered, unfortunately. When a person under this program gets any other medical insurance or benefits, like OHIP, the validity of this program coverage will expire immediately. So although these two programs serve different populations, they share a common purpose, promoting fairness and improving access to dental health care. So seniors and refugees face some of the highest barriers to dental care, and by addressing costs, these programs help prevent chronic pain, avoidable infections, and social isolation that often comes with poor oral health. They also reduce strain on the emergency room, where dental problems are frequently seen among people without coverage. Seniors are able to maintain their nutrition, speech, independence, and dignity. Refugees can begin their new life without the burden of untreated dental conditions. Families experience less financial stress, and communities benefit from healthier, more confident individuals. In closing these two programs, the Ontario Senior Dental Care Program and the Interim Federal Health Program show how targeted public programs can make a real difference when people have access to dental care. They are better able to work, communicate, socialize, and live healthy, fulfilling lives. As healthcare providers, students, policymakers, or community members, understanding these programs allow us to advocate more efficiently and guide individuals toward the support they need. So I will share the document I found. Just stay with me. So there is here you can find the Medaville Blue Cross contact information, and if you have like any questions, concern, or need assistance with your eligibility, coverage, or benefits, you can always contact Medavie Blue Cross or IRCC and the numbers provided here. So you can take a photo of these numbers, or I can provide this website on the chat as well, so you can access as well. And I also found the interim federal health program for all province and territories, except for the Quebec province. So this is the dental benefit grid, and it explains deeply. As you can see, there is 22 pages. So I will just explain how you can look and understand why they wrote here. So mostly for all services, criteria is that these services are limited to emergency relief or of pain or infections only. So only in case of emergency. And for example, emergency examination, so prior approval is not required. And the payment rule, it will be 100% covered with the provincial territorial dental fee guides. And the emergency examination, those are the limitations. So examinations are covered once every 6 months per dental office. So other like radiographs, some other types of radiographs are also 100% covered with the dental fee guides. And you can see there is a maximum of 16 radiographs per lifetime. So one panoramic radiographs with a panoramic radiograph will include both jaw on the radiograph. So it will be covered one per lifetime. And you can go and read all, or you can find some other benefit description you would like to go over. And I will go back to the presentation now. So there are also other low-cost and emergency dental resources here in Ontario. So first I'm gonna talk about the CNIH, which is a great example of low-cost dental care. It provides high-quality services at reduced fees while offering students the opportunity to gain hands-on experience in a supervised learning environment. Patients receive through assessments, professional cleanings, education, and x-rays when needed, all under the guidance of a registered dental hygienist. So for the cost, the dental clinics will be only $40 for adults for entire treatment, and $15 for children aged from 4 to 17 years. So other one is Ottawa Dental Society Emergency Service. If you need emergency dental care, the Ottawa Dental Society or ODS can connect you with an on-call dentist if you don't have a regular dentist. So when you're calling ODS number, you will hear our automated message with the name and phone number of the on-call dentist. So you will write down the information, hang up, and call the dentist directly to schedule your emergency appointment between 9 a.m. to 9 p.m. And they are work like 7 days a week. And what the emergency clinic may ask you, so your personal contact information, details about your dental emergency, when symptoms started, pain level, and if you have any swellings, your medical history, medication if you're taking any, and do you have any allergies. So you must bring your photo ID with your name, address, and contact info, medical history, medication list, insurance information if you have any, and they accepting cash or credit cards. So about the Public Health Ontario also provides free dental screenings right in elementary schools. So for kindergarten students, this is often their very first dental check, helping spot early sign of decay or caries. So grade 2 students are screened for decay in their first permanent molars, which commonly develop issues at this age. And mostly the families are notified in advance through letters, email updates, and announcement on the school website. And also parents may opt out at any time if they prefer not to have their kids participate in this program. So I will ask Neil to take from next slide. Thank you so much.
Okay, so this slide is just a review about all the services we provide at CNIH Student Dental Hygiene Clinic. This is where my colleagues and I complete our clinical training. This clinic is open to the public and it is supervised by licensed registered dental hygienists. All the services are provided at a very low cost, and I mean, it makes it an excellent option for individuals, newcomers, families, seniors, and really anyone looking for affordable preventive dental care. So, what we do at this clinic, we provide full dental cleanings for adults and children, examination by the dentist, x-rays if they are prescribed by the dentist, and we also make sports guards and whitening trays. The appointments are usually very thorough, and we spend more time with each client because we are making sure that everything is done step by step with instructor supervision. The fees are extremely affordable. The adult cleaning is only $40, for kids $15, and for sports guard and whitening trays $50 each. This clinic is a great way to maintain your oral health if cost is a concern, or if you simply want a very detailed cleaning experience. If anyone is interested, we can provide more information. Here I'm sharing our contact information. Please feel free to reach out if you have any questions. or if you would like to schedule an appointment. So to wrap up all these information, I'm gonna play a video here.
Worried about the cost of dental care in Ontario? Well, you've come to the right place. Yeah, dental bills can be stressful, but you're definitely not alone, and there is help out there. Exactly. A healthy mouth is key to a healthy life. So let's dive into your options. We're going to break down the public programs that are available to help you and your family. Okay, first up is the big one, Canada's new National Dental Plan. So, who's it for? Canadians with no private insurance and an income under a certain amount. And it covers a whole lot, from checkups and cleanings to fillings and root canals. What you'll pay depends on your family income. This chart breaks it all down for you. Ready to apply? You can do it online or by phone. Just have your SIN handy. All right, now let's talk about the kids. There's a great program just for them. It's called Healthy Smiles Ontario, and it provides free dental care for kids 17 and under. To qualify, your child just needs to be 17 or under and live in Ontario. You know, it covers all the necessary stuff, like checkups, not things like cosmetic work. Okay, we've covered the kids. What about seniors? There's a program for them too. It's the Ontario Seniors Dental Care Program, offering free routine care for eligible seniors. You've got to be 65 or older, an Ontario resident, with no other benefits, and meet the income rules. It covers a lot of routine care, and hey, it even helps with the cost of dentures. But wait, there's more. Let's check out a few other ways you can save. Refugees can get help, and for everyone else, dental school clinics are a great low-cost option. And if you're in Ottawa and have an emergency, here's the number you need to call. Okay, that's a lot of info. So what are your next steps? Let's break it down. Basically, figure out which program fits, get your documents ready, and start that application. So, which one are you going to look into first? That's the first step to get in the care you need.
Okay, so here is our references. We use all these references to provide this information for you tonight. And okay, I don't know why it's not working. Perfect. Before we end our presentation, I'm going to ask you to spend a couple of minutes to actually answer to some questions. We appreciate your feedback. It's going to help us improve our future presentations and to better understand the community needs. I'm just going to ask Kaveh to launch our questionnaire, and we really appreciate if you take the time to answer the questions.
It should be on the screen now.
Perfect. While we are waiting, if anyone has any questions, please feel free to unmute or type it in a chat. We'll be happy to answer your questions. If you need me to translate any parts or go through any details in Farsi, please let me know. If no one has any questions, I think we can end the presentation.
So we have 6 people answered the survey. Should I end it?
I don't know if anyone else is still reading the questions. And if anyone needs me to translate the questions, I can do that.
Was timed out. So,
Okay.
but
Can we save the results?
yes, there is option to download results. Then I share it with you.
Perfect. Thank you so much. I'm just going to read this question here. منظورتون برای پروگرام CDCPه؟ Okay. I'm just going to double check this. For CDCP, there's an option, if they don't have a SIN number, they can contact them for that, right?
Yeah, if you don't have a SIN number, you need to get a guarantor.
Okay. اگر که سین نامبر ندارن، کاری که میتونین انجام بدین اینه که همون گارانتور باید داشته باشین که یه فرمیه توی خود در واقع اون بخشی از وبسایت که مال CDCP هست. میتونید اون گارانتور فرم رو در واقع دانلود بکنید. میتونید از حالا اگر اینجا دنتیست دارید میتونید مراجعه بکنید به آفیس دنتیستتون و ازشون بخواید که اون فرم رو براتون پر بکنن. چیزایی که لازمه، شما باید ثابت بکنید که در واقع رزیدنس کانادا هستین برای CDCP و اینکه سال گذشته باید تکس پر کرده باشین. این 2 تا چیز خیلی مهمیه که باید در واقع به عنوان پروف داشته باشید و بعد میتونید از گارانتورتون بخواید که براتون در واقع فرم رو پر بکنه و به جای سین نامبر میتونید از اون استفاده بکنید برای در واقع اپلای کردن. حالا من دوباره یه نگاهی اینجا میندازم به برنامه CDCP. اجازه بدید من ببینم میتونم اینجا اپلای بکنم، شیر بکنم.
So for the CDCP, they need a social insurance number.
Oh,
Or
there's no
sorry.
guarantor for CDCP?
No, the guarantor is for the other ones, for the Healthy Smile. Sorry.
For the provincial programs, right?
Yeah, but the other one you need to file your taxes. As long as you file your taxes, then you could apply through that.
Okay. پس شاید همین کافی باشه. من راستیتش این الان موقعیت خاص رو نمیدونم دقیقاً چی کار باید کرد، ولی اگر باشون تماس بگیرید میدونم که خیلی دقیق راهنماییتون میکنن. برای اینکه حالا همسرتون اگر برای همسرتون فکر میکنم توی در واقع توی فایل تکستون همسرتونم بودن، ممکنه حالا مدرک دیگه ای بخوان، ولی حالا من دقیقا نمیدونم سیچویشن شما چطوریه. فکر میکنم که بهترینش این باشه که با خودشون تماس بگیرین، چون این خیلی مورد خاصیه. من نمیخوام یه وقت اطلاعاتی بهتون بدم که اشتباه باشه. ولی اگر که برای چیزی گفتین الان؟ من فکرم که آنمیوت کردین که حرف بزنید. اوکی. فکر میکنم بهترینش همین باشه که با خودشون تماس بگیرید. ولی برای پروگرام‌های خود پروینس اونتاریو اگر بخواید اپلای بکنید، اونا رو میتونید با گارانتور پیش برید اگر که سین نامبر ندارید. اگر سوال دیگه هم هست من در خدمتم. برای پسرتون میتونید از Healthy Smile استفاده بکنید چون زیر 17 ساله. برای خودتون از من نگاه بکنم اینجا رو. Do we have any provincial program that covers for under 65 years of age? I know that we have Healthy Smile for under 17.
Maybe they can
Sorry.
go with the Ontario Works.
Ontario Works?
Yeah, 311. They can call 311 for the Ontario Works and start from there.
No, the Canadian dental plan, they should be covered under that.
The CDCP?
Yeah. As long as they have an insurance card number.
They don't have a SIN number.
They don't, they could apply for it. So
They can still apply for CDCP if they don't have SIN number?
yeah, because then they just need to apply for a SIN card.
Oh no, there is like a situation that they don't have the SIN number.
Oh, okay.
Yeah.
Okay.
ولی این اونتاریو ورک هم که بچه ها منشن میکنن، اونم یکی دیگه از پروگرام هست که توی پرزنتیشن ما نبود، ولی اونم سرچ بکنید اونتاریو ورک رو. ممکنه که برای اون الیجیبل باشید. من اسمش رو دقیقا بهتون بگم. این آدرس وبسایت برای اونتاریو ورکس. ولی میگم برای پسرتون اگر که در واقع توی اون بازه درآمدی باشید، میتونید از Healthy Smile استفاده بکنید.